So in clinical case, you will not have anything outside the station. So like,
Mhm.
so you wait for 3 minutes outside the station and you enter the station. So I'm your examiner. I'm just giving you scenario. So I'm introducing. Okay. So this is a 9 years female, Tina. Okay.
Mhm.
She's on. We have a 9 years child, Tina. She is a known patient of nephrotic syndrome. Okay. She is on long-term steroids. So
Mhm.
examine Tina for the side effects of steroids, long-term steroid toxicity.
Mhm.
Okay. Do a general examination and a head-to-foot examination for the steroid toxicity. Okay.
Mhm. Okay. Um. I will wash my hands, greet the patient, and introduce myself. Hello, Tina. I am Annie, I'm a doctor here looking after you today. My name is Annie. How are you feeling today?
Yes, doctor, I'm good. Thank you.
Oh, good. Um, I'm going to examine you today. Would you like chaperone to be invited in? It will be nurse working with us today. Is that okay?
Yes, doctor, I'm fine. I'm fine.
Okay, thank you. Um, I have been told already that you had a nephrotic syndrome and you received some steroids. Is that true? Is that the
Yeah,
case?
yes, doctor. I
Yeah.
use medications as per my doctor prescription.
Okay, could you please tell me more about that, please? When you started, when you stopped them, or you are still on them?
Uh, Just a minute, doctor. This is an examination station. This is a
Okay.
clinical other station, so you do not have to ask other questions.
Oh, okay. So I can note there are acne on the face, hirsutism on the face, and I also can note you grow some hair. Is that okay? Is that the case?
And you keep presenting your findings, like you do a general
Yeah.
examination, then do a medical examination, then we'll have discussion.
Okay. So should I only comment in front of patient or in front of
Yeah, you
examiner?
keep telling that you keep talking to the exam.
Okay. So I will do a observation at first, a full observation, which I will later communicate to the examiner. So I do I have okay. I will examine fully. I will do a chest assessment after full top to toe observation. I'll do quick chest auscultation. I will expose abdomen in front of chaperone, examine the full torso skin to see any stria there, any hypertrichosis around like umbilicus or around nipples, um, and then yes, there are strias, and then I'll examine abdomen as told. We'll examine the legs to find any pitting edema, any striae on the which I can see stria on the thighs. Because the condition is nephrotic, I'll examine the legs to see any pitting edema on the legs. Yeah, and I'll take observations, blood pressure, heart rate, and also the values and plot on the appropriate chart to compare the charts, which will be most probably available. Um, um, yeah, I can see Cushing, like Cushing syndrome, lunar phase, and adipose tissue growing. I will plot the weight and which is plotted just below the 90 centile, 90, no, which centile I can't see, but it's the
Okay, this
highest,
99 centile. Okay.
yeah, 90 centile. Um, for the age. So um, yeah. Top to toy observation, faces lunar, hypertrichosis, acne, um, acne on the face. There were strias, adipose tissue grow on the back, and hypertrichosis on the torso, body, back. There were strias on the abdomen and thighs. Um, yeah. So um, um, my diagnosis will be acquired Cushing syndrome due to steroid intoxication. Um, is there any blood pressure values available? So I will tell, okay, I finished my examination. Thank you very much for your cooperation, and you can now dress up. Um, yeah, and yeah, and I will
So,
yeah.
okay, fine. So we are left with the questions now. Like, would you like to do any investigations? How would you like to investigate this site?
Oh yeah. So um so first of all, full blood count, full biochemistry, including USNEs, LFTs, bone profiles. I would like also to um, to organize short synactin test. Um, to make sure there is no um, adrenal insufficiency developed already because of high steroids use. Um, well, because already I was advised that this is steroid intoxication. I wouldn't go for um, um, at this point, I will not go for MRI to make sure there is to rule out um, some kind of pituitary abnormality or so, because I already have given the diagnosis, steroid intoxication. Yeah. Now, first, my first line investigations will be bloods with full biochemistry and possibly short synactin test after discussing with consultant.
Okay, so what exactly you are looking in biochemistry apart from liver function test?
Pardon?
What exactly are you looking in biochemistry apart from liver function test?
As I told, I will do using renal function
Okay,
test. We will collect also urine for um, um, uh, um, we will collect your my biochemistry aim is to see all electrolyte imbalance, whether
okay,
there is an electrolyte imbalance.
okay.
But yeah, um, yeah, full biochemistry for electrolyte, liver function tests, and I would at this point I wouldn't go for thyroid, but anyway, because I know the reason.
Okay, what
Um,
advice would you like to give for this patient? Any advice
pardon?
would you like to give for this patient?
Um, I didn't get what did you
What
say?
advice? What advice would you like to give for this patient?
What?
General advice.
Ah, advice. Oh, okay. So I would advise uh, um, Also, we will check blood sugar on this child. Actually, when we take the bloods, I will also would like to see the blood gas, which will show us the sugars too. I would like them to I would like them to follow the diet. To follow the diet, reduce sweets, and try to eat as healthy at this point, as healthy as possible. Second advice would be also well because there is serious problems with steroid. Well, I will check with them the steroid taking regime, whether they are appropriately taking, and if this caused by appropriate taking steroid.
Time up.
Uh,
Time up.
Pardon?
Time up. Time up. Time up.
Three
Time
Okay.
over.
We must consider to change treatment to immunosuppressants at this point, because steroids are causing the steroids are causing the problems, this kind of issue. Yeah, this will be
Okay.
my advice. Okay.
Thank you. Thank you. So, time is over here. So, how did you perform?
I'm not much. I just started preparing. I don't know exactly what, but yeah, as I use my clinical judgment at this point. I think I wasn't sure about the structure of the scenario, so yeah, but yeah. As a focused examination, I have done focused examination, um, focused to this condition. Um, Regarding investigation, I didn't go for ultrasound because it's not PCOS. Already have given that this is steroid intoxication, so I wouldn't do ultrasound at this stage, ultrasound of ovaries, or I wouldn't do MRI at this point. But in my if I asked to differentiate, I would definitely differentiate from PCOS, from pituitary abnormalities. Yeah, this is. I think the start point is because teenage girl. I asked for. I assume teenage, 9 years, not teenage, but anyway, the right thing to do to ask for chaperone. Start with chaperone examination. Yeah. I examined for edema, as they are having renal problems. First line investigation, full biochemistry, including LFTs, TFT. I wouldn't go for TFT at this point, but using these LFTs are important at this point. Yeah, and the bone.
Anybody else wants to give any feedback
Feedback.
in his presentation?
I think
Dr. Sabri, you can stop the slideshow so that everyone can be visible.
I think a few more things for examination, like first of all, we'll go systematically. We'll ask child if he can walk. There is no weakness, steroid weakness of limbs, legs and hands. We can shake her hand to see if her grip is fine or not, or we can see if the skin is dry or damp, not febrile or non-febrile, like that. Also, we can check pulse from after shaking her hand. Also, with the height, weight, blood pressure, vision. Vision was missing because he's on long-term steroid. He may have cataract. She may have cataract, so we will ask for vision. Also, we can see like she's on steroid, so we can see for genital examination, like if there is precocious puberty or not, like breast and pubic hair and genitals, I think. Also, we can check for scoliosis. We can ask her to stand and bend down, or we can examine the back like that. Also, this was in my mind. And for management, I can say, like, I will start with multidisciplinary approach for this patient. We will involve nephrologist, as he is already a known case of nephrotic, for adjusting dose of steroid or changing medication, or involve uh, ophthalmologist, psychologist, as she's a 9-year-old girl. She is obese, so she might be facing some bullying problem in the school due to acne, facial hair, and everything. Also, we can involve ophthalmologist for vision assessment, and I don't know if we can involve endocrinologist at this stage or no. So
Yeah,
this is
agree.
my uh, point
What
of view.
about the dietitian we involve in this case, management?
Yeah.
So any other feedback?
Yeah.
So from my side, the good things like you introduce yourself. Okay, you try to establish a rapport. You
I
call
can-
the child by name, and you wash your hands, and you started the introduction. Okay, so that's all good. So the scenario here is like the patient is a known case of nephrotic syndrome already on long-term steroids. So we are going to do an examination only for steroid-induced adverse reactions. So the other session is it's like a googling only. So we should be prepared for seeing anything in other session. So if the instruction is to do a general examination, we can start from, you can have a format. Say, for example, you can start from the hands. You can see the pulse, okay? And then you can look at the axillary hair, and look at the skin over the shoulder, because those are the areas where you get the striae, or the shoulder, or the knees, or the thighs, or the abdomen. So those are like areas where the striae are common. So like you can go for the hands and shoulders, then you can go at the neck. Okay, so neck you can look for something like an hump, the buffalo hump. You mentioned the swelling. Okay, so you can call it as the buffalo hump, typically seen in the Cushing syndrome. And also you can look for acanthosis, so a sign of insulin resistance. So those things can be seen in patients.
Dr. Sabri, the voice is not clear in the
Okay,
class.
am I audible now?
Yeah.
Hello.
Maybe a bit slower. I think they will be able to understand.
Now am I audible? Hello.
Yeah.
Okay. So you can start from the hand and then go to the shoulders, then go to the neck. Okay. So you can look at the neck for acanthosis or a buffalo hump. Then you can look at the face. Okay. So always describe the face. The typical face is a rounded face. The typical moon-like face is with puffy cheeks, and she had an acne. So those things, oily faces, those are all marks of like the patient is having steroid side effects. Okay, then you can go like from eyes. Okay, so eyes, although you need not put a torch because that could be causing a discomfort, you can tell that I would like to involve for a formal eye assessment to look for cataract as well as glaucoma. Both are side effects of long-term steroids. So then you can look at the oral cavity. Oral cavity, patients who are on long-term steroids, they'll have this oral candidiasis. So as well as you can just look at the oral hygiene. Okay. So after that, you can go for the facial hair. You can mention about the his part, acne part. Then if it is a male, you can comment about the gynecomastia. Okay. And respiratory system, you can talk about there is a signs of pneumonia. Typically, it is not get in exams. You can just make a word of it. And being a nephrotic syndrome, you can tell about abdomen. I will look for any tenderness, brief fluid, as well as any signs of a bacterial peritonitis. Because patient is on steroids, they are immunosuppressed, they can go for infection. So those things I look for. Then you can go for the lower limb. You can tell about the muscles. Okay, so typically the proximal power. So steroid induced myopathy. So you can offer test the proximal power. Okay. So that you can offer for testing the proximal power. Then the typical long-term side effect is the avascular necrosis of the hip. Okay, so that is one common weight-bearing bone where you go for avascular necrosis in patients who are on long-term steroids. So you can ask for the hip movement. You can do those things. You can make a mention of it. Then finally, you can also tell that I would like to evaluate this child for osteoporosis, because osteoporosis do not have particular any clinical sign, specific sign or symptom. They tend to have a diffuse bone tenderness. Okay, so these are the things you can do. So main thing is in the whatever 6 or 5 minutes what we have, we will not be able to do everything. Okay, so you can always have a list, like in order to complete my examination, you can do a vitals, including your blood pressure. Okay, then you can I would like to plot the centiles and growth charts. Then we can also say I would like to put a Tanner staging, particularly for the adolescent. And for steroids, you are expecting the patient to have a short stature. So you can also mention about that. I would like to plot the height on centiles chart. Then you can do an urine dipstick, okay, to look for sugars. So steroid-induced hyperglycemia, you can offer as a bedside examination, you can offer a urine dipstick. As well as you have to offer a fundus examination at the end. In order to complete my examination, I will do a fundus to look for any signs of papillary edema that can be a side effect of idiopathic intracranial hypertension secondary to steroids. And I will to do a formal eye assessment. So that could be a way to tell that in order to complete my examination. So these things you can have at the end. Okay. So the thing is, you may not have all the findings, because typical exam case, they may not keep the patient who is having ASL necrosis or who is having a severe myopathy, because they may not keep, but you are expected to observe for all these findings in patients who are on steroids. So you can just keep on telling it from head to foot in a way. So, and the management part, you can always tell that I would like to involve the consultant. Okay. And the thing is, imaging is not required here. Here, we have a clear-cut case of a patient who is on exogenous steroids, Cushing's syndrome. This is not something a primary disease. So we are looking for an MRI here. And general examination, it is better avoided. We are not going to do this, because this is not something internally possible. We are giving steroids from the external source. So we are looking for only for the steroid side effects. So investigation part, you can tell about, you would always like to review the whole records and calculate the cumulative dosage of steroids for the patient is on. So that could be one thing. And you can offer to do a blood sugar testing. Okay. So to look for a shared glucose diabetes mellitus, and you can do a lipid profile to look for dyslipidemia. Okay. And you can offer, in case the patient has a hip pain, you can offer an imaging for hip after discussing with your consultant and maybe involving the orthopedician, pediatric orthopedic team. You can offer an imaging for the hip, okay, if the patient has a hip pain. And in case if the patient has a diffuse bony pain and you're suspecting osteoporosis, then you can offer a DEXA scan after consulting my primary consultant. So that would be the way you can line up the investigations for the steroid doses. And the advice part, particularly, the thing is, the patient on long-term steroids, they have this bracelet, right? They carry this bracelet or cord, because these patients are on long-term steroids, so they need to have this bracelet or cord, like these things, to say that they are on long-term steroids. And you will always advise the patient to be compliant as per the doctor advice to go with the regular dosing of steroids and tapering as per the advice. And you will also try to check their vaccination records. Maybe we can give some vaccination patients who are on this steroid they require, maybe, and you have to be very sure of the vaccination. And you can advise about the general hygiene, avoiding infections, avoiding crowded places, avoiding contact with people who have maybe an pneumonia, LRI, something like that, or avoiding contact with maybe the patients who have infections like tuberculosis. Those things you can avoid. And if the patient has a fever or anything, then these patients should not be stopped on steroids. So you will try to involve a consultant, and maybe if the patient requests, you may have a stress dose should be given. So these things you would like to advise the patient to attend the emergency, because they may not have the typical signs of infections. So infection signs may be masked. So you will tell the patient if he has warning signs like child is not active, lethargic, maybe not voiding, okay. She's a bit confused, not taking feeds. So these are warning signs. You can always, even if it is a simple illness, you can attend the hospital. You can give them an access card to attend your OPD. So these are the advice you can do. This is from my end. And
Thank you.
regarding, there was a comment asking for the permission for the mother to examination. Yes, If the attendant mother is there, you can always wish the mother, you can introduce yourself to the mother and you can tell the mother, I'm going to examine your child. Is that okay for you? You can always ask. But here, I think the doctor asked for a chaperone. That's a very good thing. So if attendant is not there, then you can always ask for a chaperone, particularly for a adolescent age group and like child. So that's a good thing you asked. And general examination part, always remember the 4 Ds. Okay, so the child is in distress, dimensions. Okay, so any devices around, is the child wearing any glasses? Does she have cataract and she's on wearing corrective glasses? To show those things, you can always ask for. And if there is any dysmorphism, okay, so here you do not have dysmorphism, but we have a question about cases, so that you can comment in general examination also if you want. So you can remember the mnemonic like 4 Ds. Okay, so distress, dimensions, dysmorphisms, devices, like that.
Okay, thank you very much.
Sir, would you like to add any policy?
Well, actually, someone wanted to participate. I think Vasan, no? Vasan, it is. You wanted to add something?
Thank you,
Vasan?
doctor. No, it's just only the doctor mentioned just the exam from the start, just the introduction and permission, and then the comment general, and then the gate. We need to comment on the gate because she had the, I think, she's on steroids, so maybe she had proximal myopathy. So we need to comment,
Yes,
ask her.
I think Annie covered a lot about all the aspects, but I think the systematic approach everyone felt. So you need to have some process. Either you start from the hands, you slowly move on to the axilla, then you go to the eyes, face, and slowly come down. No, so then you will have that systematic approach. So that you can. But otherwise, you picked up all the points. Maybe myopathy.
Yeah,
You can
I didn't think about myopathy, to be honest. Yeah, it's good point to
eyes examination, I think that you can talk. And regarding investigation, also start from bedside. So I would look for
what I
the
was saying. Bedside start. I started with bedside. Yeah.
start with blood sugar. I think that will be better. And initially, you had that one confusion about history station. So that thing you should avoid because you have only 6 minutes. In that also, they give the tasks, only 5 minutes are there. So there we cannot keep asking questions and history. You should not use what station. So it's a examination station. Straight away you go there, you do
Yeah.
your intro. But otherwise, you picked up all.
I just started preparing like from
Yeah, it's
20
good.
after my application. So yeah, it's very good point to mention. So can I ask a question because I just started. This is my first group I'm joining. So clinical is history taking, physical examination, and what else involves in clinical?
In clinical stations, you are not allowed to ask
Patients,
history.
Yeah.
So
in
you
the
have 4
format,
clinical stations.
Okay.
asking
The
the
group, about the format what is happening. So you have 3 minutes outside the station. Okay.
Mhm.
So you will not have a clue what is happening inside. So once you enter inside, the examiner will tell examining this is a so and so child. You are examining cardiovascular system.
Mhm.
Okay. So you do not ask any history from the patient. You ask the consent. You wash your hands and go with the examination. So start with the general examination, then go to system examination.
Okay.
Okay. So often you will not be able to complete the examination. So you can always have that, do not get panic. You can always tell in order to complete what I will do. Okay. So you
Okay.
can tell that, for example, if it is maybe an abdomen session, you have not examined your renal angle, you can tell in order to complete, I would examine the renal angle. So you can always have that backup. Examiner understand that this is we have only 5 minutes time, so we will not be able to logically cover all the points in examination. But whether you have an approach to check everything, so that's the thing we are going to do.
Okay. All right. Thank you. Thank you very much for feedback.
Thank you, Anu. Thank you. Okay, Dr. Sabri, you can move on to the.
Can I go to the next question?
That's like.